Trudeau offers Premier's 46.1 billion US in new money over next decade for healthcare. The Trudeau government offered provincial premiers 46.1 billion in new funding over the next decade for healthcare, but the new funds will come with significant strings attached. Prime Minister Justin Trudeau presented his opening offer to provincial premiers on Tuesday. Over the next decade, healthcare transfers were already set to rise considerably as Canada's economy rebounded from the pandemic. The existing formula would have delivered a grand total of $142 billion over those 10 years in additional money through the Canada's healthcare transfer. The healthcare transfer currently rises by at least 3% or the rate of GDP growth, whichever number is higher. For the next 5 years, under the Liberals' new proposal, it will rise by a minimum of 5%. That new 5% floor will allow overall funding to climb with higher payments in first 5 years, adding up to a total $17.3 billion more to the system than the current plan. Provinces will also get another $2 billion as an urgent top-up this year to deal with the lingering COVID backlogs and overwhelmed pediatric emergency rooms. On an annual basis, 5 years from now, the federal government will be sending $60.3 billion per year to the provinces in the Canada's health transfer, and 10 years from now it will be over $72 billion per year, up to considerably from the approximately $45 billion it spends today. Premiers had wanted to see an immediate $28 billion increase to the health transfer and to have it rise at 5% a year after that. All of the Liberals' new money will only come if provinces agree to data sharing on key indicators and to continue their health spending at their current levels. The federal government wants the new money to boost healthcare spending, not supplement provincial dollars. There is another $25 billion available for one deals with the provinces, but that money must be spent on specific areas including mental health, family doctors, recruiting health workers, and modernizing the health system, including looking at digital health records. The Liberals promised during the 2021 election campaign that they would provide more funding for a dedicated mental health transfer and for enough funding to add. Manitoba Premier Health Stephenson said they were happy to get to the table with the Prime Minister, but the fund is opening of a far disappointing. What we did see today is that there wasn't a lot in a way of new funding that is a part of this package that has been put together by the federal government, she said. Ontario Premier Doug Ford said Trudeau's opening offer was just the beginning and he would be pushing for improvements on what is on offer. I always welcome new funding, no matter small or large, but what we see, this is a starting point. It's down payment on further discussion, he said.